Well, good evening. I think we're gonna get started here. It's 6 o'clock. Um, my name is Mark Wagner, and we're gonna talk about stem cells over this next half an hour or so, as far as kind of a general overview as to kind of what we use stem cells for. It is a non-surgical, minimally invasive procedure. Um, Just a little background on myself. I've been in the Seattle area for 35 years, founded Seattle Sports and Regenerative Medicine, was the senior and directing medical director of the Sports Medicine Clinic, which was the oldest and largest sports medicine clinic in the country. I was at University of Washington for many years, consulting team physician to the Mariners. I am board certified in primary care and sports medicine, and a diplomat of the American Board as well. So what do we treat with stem cells? Well, I want to start on the bottom left-hand corner, synovitis. Synovitis is just inflammation of any joint, okay? And typically for inflammation, we're probably more so just looking at procedures such as PRP. Osteochondral defects. These are craters, they're chips, they're little punched out areas in the cartilage of a joint, most commonly in ankles and in knees. Now, we see them in kids sometimes, but those will sometimes heal on their own. But we do see them in adults oftentimes as a result of injuries. Osteoarthritis, the biggest thing that we treat with stem cells, and it's osteoarthritis of ankles, knees, hips, wrists, elbows, shoulders. Meniscus tears, those are knees. We can treat meniscus tears with stem cells. We don't have to take those tears out surgically. Labrum tears, so the meniscus of the shoulder is called the labrum, although it's more of a gasket. And we see it in shoulders, we see it in hips as well. They respond very well to biologics, to stem cells. Partial ACL tears we treat as well, although I do not necessarily treat complete ACL tears. And we'll talk about that a little bit more. I've got a couple of unique cases there. Rotator cuff tears, very well treated or treated very adequately and actually better than surgery for partial rotator cuff tears. Chondromalacia. This is damage to the cartilage on the backside of the kneecap, usually without involving the bone yet. And tendon injuries. We see a lot of tennis elbow, golfer's elbow, patellar tendonitis, Achilles tendonitis, and those respond extremely well. Okay, osteoarthritis, probably the number one thing that we treat with stem cells. So osteoarthritis is an inflammatory condition of any joint. Here I've pictured two knee joints on the same patient, right and left knee. This actually was a patient I treated 10 years ago. She is in her 60s, and she just happened to come back and see me a few months ago for a shoulder injury. And I said, "Well, how are your knees doing?" She said, "Oh my God, they're fantastic. I can do everything that I want to do, and I have no pain whatsoever." And this has been 10 years. This is severe arthritis in a patient, where you see kind of pretty much loss of the joint space on the medial side on both sides. Osteoarthritis can affect ankles, big toes, midfoot, knees, hips, wrists, elbows, and shoulders. Osteochondral defects, these are kind of, it's almost like a limited area of osteoarthritis where there's one specific area where either the blood supply to the bone and cartilage in a certain area has stopped and that area has died, or it's as a result of trauma. Meniscus tears. So the meniscus, everybody, talks about meniscus tears in knees. We used to go in and still a lot of surgeons do say, oh, we're just going to take out the portion that's torn. Well, that's not a great option because there's a reason that that meniscus is there in your knee. And it provides support, it provides stability, and it provides basically cushioning in the knee. If you take it out, 10 years down the road, you're going to end up with arthritis in the knee. So we like to be able to heal those. Now, meniscus does not have a blood supply, nor does labrum, nor does articular cartilage. So the only way we can improve things is by putting a blood supply there. And that's what stem cells do. And we'll talk about that a little bit more. Labrum tears, kind of very similar to meniscus tears, don't have a blood supply, won't heal on their own. We don't want to take them out if we don't have to. We like to be able to heal those. And we see those in shoulders as well as in hips. Partial ACL tears. So if an ACL is partially torn, they respond extremely well to biologics, to stem cells, because the stem cells that we isolate can grow up to be cartilage, muscle, and tendon and bone. And in this case, we need tendon. Now, complete ACL tears, I said I don't usually treat complete ACL tears. However, I have a patient, I've had two patients actually, that absolutely did not want to have surgery. One was a Nordic skier from Norway who was an Olympic silver medalist, and she had complete healing of her ACL tear after stem cells. And then the other is an MMA fighter who came in to see me, and she absolutely refused surgery. And I told her, I don't know, I can't guarantee that you're going to get healing of this ACL. We did her ACL. That was about 3.5, 4 years ago. She came back and saw me about maybe a year ago because she tore the ACL in her other knee and she wanted to do stem cells because her knee that we did 3.5, 4 years ago was 100%, and she was back to MMA fighting with no issues whatsoever. And now I've seen her 6 months after this second knee was done, and she's doing great as well. Rotator cuff. If somebody comes in and they had trauma, they had a fall, they landed on their shoulder, an outstretched hand, and they completely tore their rotator cuff and they can't lift their arm up past about 30 degrees or so, then we have to do surgery. But otherwise, partial tears or chronic tears that have been there for years, we treat and they do extremely well with stem cells. The reason being, the area where these tears occur is called the avascular zone in the tendon. And it has a really, really poor blood supply. So if you put sutures through that area, you compromise the blood supply, and 60 to 90% of those surgeries fail within 5 years. However, with stem cells, you're looking at about 75 to 85% of patients who respond extremely well and get back to full activity. Chondromalacia. So this is where you get damage kind of behind the kneecap, where you see cracks and fissures and craters in the Teflon covering, the articular cartilage, without yet involving the bone. Because if it does involve the bone, then it's osteoarthritis. Chondromalacia, we see it in runners a lot. People get their knees grind and they crack, and it's painful going downstairs, or if they sit in a theater for 2 hours or a dinner for 2 hours. And a lot of times I see these in runners, more so in women than in men, because they have kind of tracking abnormalities in their kneecaps. And we treat a ton of these with stem cells, and they do great because it's not even the weight-bearing portion of the knee joint. Tendons, I treat a lot of rotator cuffs, like we talked about earlier, Achilles tendons, patellar tendons. Once again, if somebody has a complete tear of the Achilles or the patellar tendon or the quadriceps tendon, we need to do surgery and we need to surgically repair those tendons. However, if they're partial tears or chronic inflammatory problems with tendonitis, we treat those with biologics. And when I say biologics, I'm talking about stem cells. Synovitis, inflammation in the joint. The synovium is this feathery-like tissue that lines the joint, and it can get inflamed, and then it produces fluid because that's your joint's way of protecting itself, kind of like an airbag in your car. Synovitis, typically I treat with just platelets, with PRP. I don't need to do stem cells because I'm not trying to regenerate tissue if we're just purely looking at synovitis. Okay, so what's regenerative medicine? It is the field of study that utilizes stem cells to heal and regenerate damaged tissue. It is the use of autologous, meaning stem cells from your own body, adult mesenchymal stem cells that can regenerate muscle, tendon, bone, and cartilage. So a stem cell is an undifferentiated or unspecialized cell in the body that has the ability to renew themselves and transform into cell types within the body. Okay, we've got this short video. It's about 4 minutes or so, and it kind of gives a very simplistic overview of stem cell therapy. I'm going to try to get this to run on this Zoom call. So let's see what we can do here.
Hey everyone, big heads up, Paleo Valley's running a sale on all their meat sticks right now. You can get 30 sticks for $36, which comes to $120 per stick. But before
here we go. Hopefully this is showing up for everyone.
Injection treatment designed to heal injuries and reduce pain. It is used for arthritis.
Hey, Dr. Wagner.
Injuries to ligaments.
I can just take over because it's not showing up on.
Okay, you want to take over? So is there audio?
First, let's look at the difference between human embryonic stem cells and adult stem cells. The embryonic stem cells are pluripotent, meaning that they can become of any.
Hopefully this is coming across.
Differentiated cell types of the human body. On the other hand, adult stem cells are multipotent, meaning that they can develop into more than one cell type, but are more limited and controlled, and thus safer than pluripotent.
Is there volume on everybody's end here?
All cause damage to the structure. To keep your house in order and repair any damage, you need different professionals like firefighters, construction workers, insurance agents, and a contractor to supervise and direct the project. This is no different than your personal life. You need a dentist, lawyer, financial advisor, doctors, insurance agent, and a barber, along with other professionals. So, both your house and your life require different professionals and specialists to keep them working well. And your body needs stem cells. Now, let's dive deeper and see what happens to your joints. In a normal healthy joint, you have plenty of stem cells. These cells are not only capable of doing maintenance and repairs, they also know when and where these repairs are needed. Stem cells work as a contract that, in addition to giving instruction for repairs and maintenance, can transform to specialized cells to do whatever is needed to fix any problem. When you have enough of these stem cells, there's a balance between damage and repair, and you have no pain and no injuries. Think about when you were 18 years old. You were able to run, jump, and do the same the next day without pain. The only problem is that with time, the number of these stem cells goes down, or sometimes the severity of the injury or damage is more than the ability of your body to repair it. This leads to an imbalance and ultimately leads to arthritis, injuries, and pain. In essence, as you age, you have a lower number of contractors and workers available to do the job, or sometimes the amount of damage is too much for the available stem cells. But fortunately, there are areas of your body that keep a good number of stem cells. These areas include the bone marrow of the hips and the fat in your abdomen and buttocks. And this is the key to stem cell therapy. The doctor will take stem cells from one or both of these areas and transfer them to the area of injury or arthritis. This will provide the stem cells needed for repair. In essence, the treatment will supply the manpower needed to do the job. Once there, these cells secrete growth factors that will organize and coordinate other cells to do the repairs. This leads to healing. This is like the contractor giving instructions to get the job done. This treatment can be used for pain with injuries coming from ligaments, tendons, muscles, bones, cartilage, and meniscus. When is it useful? If you have an injury or an arthritic condition that did not improve with therapy, medication, other injections, or surgery, or if you were told you need surgery, then stem cells is a great option for you. Thanks for watching.
All right. Now, how do I get back to my slides, Chelsea?
All right, so what you are gonna do is at the same area where it had share before. I stopped sharing, so you should be able to share yours now. And then you'll just select the PowerPoint again. Also, thank you for everyone leaving feedback in the Q&A about not hearing it.
All right. It's not letting me go to my.
I can pick it up if you want.
Oh, here we go. Here it says, what is stem cell therapy? And I am screen sharing now.
Yep, you're screen sharing. You're good. So just hit the next slide and you'll be good to go.
Not letting me go to the next slide. Oh, here we go.
Okay.
Okay. So how do stem cells work? Basically, when we were 10 years old, there were 200 million stem cells flying around through our bloodstream at any one given time. When you hit 60, we're down to about 200,000. But even though we have less stem cells as we age, there are still localized pockets of concentrated stem cells in your bones and your bone marrow and in your fat. So not only can stem cells regenerate tissue, but they can decrease inflammation and stop arthritis, which is inflammatory disorders of the joints. So even at, we have over 500 patients that we've treated in their mid-90s, and I have 2 patients who are 103 that we've treated their hips, and they're 2 women who are friends of each other, and the first one did so well, she referred her friend to have her hips done. So yes, you have less stem cells as we age, but we still have plenty in certain areas, and we can extract those and concentrate them. All right, so we see a lot of patients that come in and they went to see the surgeon and he said, well, you're bone on bone, you got to have a total joint replacement. First of all, 90 some odd % of those patients that were told that they're bone on bone, when they bring their films in and we sit down and we look at them, they're not bone on bone. It is the most common misnomer that I see in medicine because, and I just found this out about a year ago from 2 of the guys who are on the board at Regents and Blue Shield, that in order to get total knee replacement covered by insurance, the term bone on bone has to be in the dictation. So even if patients are not, they're labeled as bone on bone oftentimes. So big data on total knees. 65 to 70% of patients who have them are happy with the results. But that means 30% are not happy and wish they'd never had it done. And they can end up with pain that's worse afterwards. And then it's an end game. There's nothing else you can do. I probably see 4 patients a month who come to see me because they had a total knee a year or 2 or 5 ago, and they're miserable and they want me to do stem cells. I said, well, there's nothing I can do now because all you have there is metal and plastic. The other thing, it's a year rehab. It's a big surgery, and there is the chance that you can develop infection, blood clots, which can lead to pulmonary embolism, heart attack, stroke, loosening. The knee replacements do not last forever. You're looking at, depending upon your weight and your activity level, 8 to 15 years. There are studies out there that suggest that there may be an increased incidence of dementia, and that's because of chromium, cobalt, nickel, and titanium. And then the other thing is if your BMI, your body mass index, is over 28, all of these complications or the risks of complications increase tremendously. So what do we do for stem cells? Basically, we tell patients no anti-inflammatories for 6 weeks afterwards, because the way stem cells work is by creating inflammation. That's how we heal. Now, sometimes inflammation gets out of hand and then we have to treat it. But in this case, in that first 6 weeks, we want the inflammatory process. We tell patients to be well hydrated, drink lots of water. The only medications that we sometimes need to talk about is if somebody is on a blood thinner, we may or may not need them to stop that for a day or two. The procedure itself. So patients come in, we draw blood. From the blood, we obtain platelets. Platelets are these great little packages of growth factors and anti-inflammatories and cytokines and exosomes, and they are basically fertilizer for the stem cells. I then do a bone marrow extraction, which we do in your what's called your posterior iliac crest. It's basically, if you look at your spine, which goes down the middle of your low back, they're the two broad bones on either side of the spine, and that's where we do the bone marrow aspiration, okay? I've done over 23,000 of them. It takes me less than a minute to do a bone marrow extraction. Literally half the patients are like, are you kidding? You're done already? And half are like, wow, I can really feel that. It feels like sciatic nerve pain going down my leg, or it feels like a deep hollow ache. However, if you're in that half that it's uncomfortable, it lasts about 30 seconds. Now, we do give you pain meds. We do use local anesthetic as well. Then we do a mini liposuction, kind of in the love handle area, because the stem cells that we obtain from bone marrow are very robust and long-lived. The stem cells we get from fat are prolific. We get tons of them. We then, by virtue of a very complex software program that was developed actually by a buddy of mine who ran the molecular biology department at Stanford, we're able to just isolate out mesenchymal stem cells. We just want those because they can grow up to be only muscle, tendon, cartilage, and bone. And we're going to obtain those in billions. Then, with the use of ultrasound, we guide our injections to either the area, whether it be muscle, tendon, or joint, that we're treating at that time. The whole procedure takes about an hour. That's the harvesting of the cells, the isolating the cells, the concentrating them, and the injection. It's local anesthetic. Patients are awake, listen to music. You walk out. You do need a ride, okay? And we start physical therapy usually a week after the procedure. What are the contraindications? Who do we not treat, okay? If somebody has an infection, we're gonna delay the procedure until that active infection is taken care of. If somebody is on chemotherapy, if somebody has bone marrow disorders like multiple myeloma, then it's not an absolute contraindication, but it's something where I talk to their oncologist or their treating physician before we move on with planning the procedure. And then blood thinners, we may need to work on that a little bit. We may need to do something called a Lovenox bridge for 3 days, or sometimes after talking to the treating physician who's got the patient on blood thinners, we may just go off of it for a day or two. Okay, so unfortunately, there are a lot of people out there, mostly chiropractors and naturopaths, who are using allografts. So allografts are stem cells that come from elsewhere. You can buy stem cells online. I could go online right now and I can buy them. They come from women who are willing to sell their placentas. It is a sketchy patient population, mostly from south of the border. There are zero live stem cells in that product. It's a desiccated powder that these offices they hire nurse practitioners to do the injections because they're not by law allowed to do injections. So they hire nurse practitioners. Basically, they pour some sterile saline in, mix it up, and inject it into the joints. I've seen some real disasters that have come from Mexico, patients who've gone down there to be treated, who've developed really, really bad infections and severe pain afterwards. And so I'd be really, really cautious about seeing anybody who's using allografts or anybody that's not a board certified physician who has lots of experience in doing these procedures. So how do people do? Well, patients with mild to moderately severe osteoarthritis, big data says 80 to 85% of patients see at least 80% improvement. In my patient population, overall, and this is patients who have mild arthritis, meniscus tears, labrum tears, tendon tears, to patients who have severe osteoarthritis. But overall, 91% of our patients obtain at least 75% level of improvement. So I'm going to go through, briefly go through just some scientific journals and some big clinical studies that are out there. First one is from the Journal of Bone and Joint Surgery. There was evidence of meniscus regeneration and improvement in knee pain following treatment with human mesenchymal stem cells. These results support the study of human mesenchymal stem cells for knee tissue regeneration and protective effects. From the Journal of Clinical Orthopedics and Trauma, the versatility of stem cells as a treatment modality has landed at another repair target, osteoarthritis. Through many studies, this newly discovered method has been shown to significantly alleviate the pain experienced by osteoarthritis patients. From Helion, the study showed that a single intra-articular injection of bone marrow stem cells provides long-term benefits. The procedure is simple, fast, well-tolerated, avoids the need for hospitalization, and generated no complications or adverse effects. From the Journal of Orthopedic Translation. In contrast to traditional treatments based on drugs, proteins, or antibodies, stem cells are poised to revolutionize medicine as they possess the capacity to replace and repair tissues and organs such as those in osteoarthritic joints. From Nature, which is basically the UK's New England Journal of Medicine, in conclusion, mesenchymal stem cell treatment improves knee pain, physical function, and cartilage quality without severe adverse events. Then we talk in mesenchymal stem cells and regenerative medicine, cartilage mapping by MRI imaging showed improvement in good cartilage quality and significant decrease in poor cartilage quality. I have many other studies here, but they're kind of technical and I won't go through all of those. Now there have been over 55 million cases done in the United States. As long as you use your own stem cells, there have been no significant adverse events reported on the FDA database. No general anesthesia is needed. Everything is done with local anesthesia. Afterwards, I tell the patients we rest, we get back to activity. Activities of daily living as far as walking are fine, whatever's tolerated. No anti-inflammatories, that's like no Advil, Aleve, Motrin, ibuprofen, no turmeric, no CBD. And then we start physical therapy, usually 5 to 7 days after the procedure. So that's kind of a brief overview. And now I'm going to open it up to everybody's questions because that usually kind of gets into a lot more. And then Chelsea's going to get those questions to me and we'll just go through those.
Okay, so first question. Can you harvest bone marrow stem cells from someone with severe scoliosis and degenerative disc disease?
Absolutely. We're not taking any stem cells from the spine at all. It's all done in the pelvis, posterior aspect of the pelvis. So yeah, there's no involvement of the spinal cord or the vertebrae of the spine.
All right, next question. Can stem cell treatment be used after surgery of shoulder repair or meniscus tear trimming?
Yes, it absolutely. I have a lot of patients that come to me for that, which, they'll go and they'll have the surgery done. And there isn't anybody in the Northwest who's doing stem cells at the same time as surgery, which is kind of sad. There's a few guys in Florida and California who are doing that. So I'll have either the surgeon refers them over here to have a stem cell procedure about 6 weeks after the surgery. And it really makes a difference not only in healing, but in preventing osteoarthritis in the long term.
Does chemo impact stem cell health? I am nearly 2 years since completing chemotherapy.
It all depends. And that's a case where I usually talk to the oncologist to see if there's any issues there. It all depends on the regimen that a patient is on.
Someone said, why PRP instead of stem cell?
So I do PRP with stem cell, and that's kind of the gold standard. You want PRP, stem cells from bone marrow, stem cells from fat. That's what we do at Mayo Clinic, Cleveland Clinic, Johns Hopkins, Harvard, Stanford, everywhere. However, sometimes I will just do PRP if I'm trying to decrease inflammation in a joint and there's no other problem, or if we're trying to decrease chronic tendonitis, tennis elbow, golfer's elbow, Achilles tendonitis, things like that, where we're just dealing with inflammation, but we're not trying to regenerate tissue.
Let's see. Someone said acetaminophen, question mark.
Acetaminophen is fine throughout the procedure and the recovery process. No problem with that at all.
Someone else asked, can you treat multiple joints simultaneously?
Yes, we can do up to 3 large joints at the same time. And actually, it for a number of reasons. Number one, you go through the therapy at the same time. Number two, you only have the procedure, in the bone marrow and aspiration liposuction done once. And number three, it actually saves you a significant amount of money because every time we open up the sterile surgical kits for this procedure, that's the big expense. So if we can avoid, doing 3 separate procedures or 2 separate procedures, it does save you quite a bit of money.
Please review the discussion of the I'm assuming that's chondromalacia behind the knee.
Okay, so chondromalacia is when the Teflon covering behind the kneecap and where the kneecap meets on the femur, which is the upper leg bone, that cartilage gets soft, it starts to fibrillate, it starts to crack, it gets fissures in it. Sometimes when we get in there with a scope and look at it, it kind of looks like crab meat. But it's not yet affecting the bone that underlies that cartilage. And it can cause, quite a bit of knee pain. We see it a lot in runners, especially women runners, and it responds extremely well to biologics because we can regenerate that cartilage. And then we work on tracking issues for the kneecap so it doesn't keep coming back.
Someone said stem cell after bunionectomy.
If that joint is arthritic and still painful, yes. And we do a lot of, it's called the first MTP joint. We do a lot of procedures for MTP joints as well as what we call CMC joints, which is very similar, but it's in the hand and it's at the base of the thumb.
Someone asked, do we need to have tried previous injections such as hyaluronic acid, steroids, PRP before trying this?
Not necessarily, no. Sometimes there's no need. First of all, I do not agree with doing steroid injections in weight-bearing joints because it breaks down the cartilage even more. So you might get a couple weeks or a month or two of relief, but in the long run, it damages that articular cartilage. So I do not like doing steroid injections. As far as hyaluronic acid, I mean, that's something certainly you can try, but it is short term. It gives people maybe anywhere from 4 to 8 months of relief, but it doesn't do anything as far as regenerating tissue. So no, you don't have to have any of those as a prerequisite to having stem cells done.
Someone said they are bone on bone in both thumb joints. Can stem cell therapy help them?
Absolutely, because they're not weight-bearing joints. So even if they are bone on bone, it's not an issue. And the surgery for that joint is a surgery that does not have great results. So yes, and actually I'm living proof of that. 9 years ago, did stem cells to both of my CMC joints, the thumb, base of the thumb joints. And I'm doing great back to fly fishing, tennis, planting ski poles, and not having any issues whatsoever.
Someone asked, why is stem cell therapy not covered by insurance?
So there's a lot of politics involved. For the most part, orthopedics departments runs hospitals and because they bring in the money. And, total joint procedures are big surgeries that make the hospital the surgeon, the ambulatory surgery centers, the prosthetics companies, a lot of money. So there's a lot of, effort to not replace that procedure with a procedure that is, 1/10 to 1/15 the cost. Um, so it's hard to fight against that. Although places like Mayo Clinic, Cleveland Clinic, Hopkins, Harvard, Stanford, Curlin, Joe, Stedman, all the major orthopedic centers in the country are doing stem cells because they work, but they're still not covered by insurance.
A couple of people asked, when will insurance start covering it? I feel like I could answer that, and we don't have any idea, unfortunately.
It's not even on. I talk regularly to two guys I know who are on the board at Regents and Blue Shield, and it's not even on their radar screen.
Kind of along those lines, someone asked about the cost.
So it all depends, small joints, anywhere from 4 or 5 thousand for a small joint, depending on, and then large joints between 7 and 8 thousand. Multiple joints can be 11 up to 15,000. It varies tremendously depending on large joints, small joints, and how many joints.
Someone asked, can stem cell treatment be used on the back with degenerative disc disease? Would it do anything?
It can be used, although the data isn't as good as it is for joints. I do not do spine. I'm just too busy with joints. But I do have some people who do spine down in the Portland area and in Vegas who are excellent with it.
Someone asked if we do physical therapy at our clinic.
We have a physical therapy office that shares space with us here, but we have therapy offices. We know all the therapists in Western Washington and probably in almost all of Washington that we refer patients to, because we see patients from all over the world that fly in and have procedures done. So we have connections with physical therapists pretty much everywhere.
Someone asked, how would someone know if they are a candidate? They've been having hip pain for some time.
So basically imaging, an x-ray to start out with, and that might be all that needs to be done, and that can be done here at the office. And sometimes if the x-ray doesn't give us the information that we need, then sometimes an MRI, which we can schedule here as well, and then a consultation from there.
Another person asked, how much cartilage will this regrow in the knee?
It varies tremendously on patients as to the amount of damage they have and to their weight, their activity level, where they are in the course of the disease process. I actually just had a patient come in. Oh, this was last week, and she had had an MRI done on her knee for a new injury. I think it was soccer. We had done stem cells on her knee 3 or 4 years ago, and it was the same radiologist. And he said, "Oh my God," he goes, "I am absolutely amazed at the difference between these two MRIs from 3 or 4 years ago. You have absolutely normal appearing articular cartilage. You got a meniscus tear, that's new. You injured that playing soccer. But kudos to Dr. Wagner and his team, because I tell you, your knee is completely normal now."
Someone asked how much a consultation is.
Chelsea, you can probably answer that better than me.
The cost for the visit is around $318 for the appointment. And then if we need to do imaging, it's about $100 per area that we x-ray. We do provide discounts for the consultation if you are self-pay, but we can also bill insurance for those visits. While insurance does not cover the stem cell procedure or PRP, they can cover a lot of the office visit and imaging. Someone else asked if they can pay over time. Again, I can probably answer that one. We don't have payment plans at our office. It's just not something we can facilitate. And then someone else said that they have an X-ray and an MRI already. Are we able to view them and determine if they are a candidate for treatment?
Absolutely. And we do it one of two ways. If patients are local, you come on in, you bring your images with you, and I view those images here. I like to see not only the images, but the report and the images. And then if like I said, we see people from everywhere. I mean, there's sometimes I've seen people from Asia, from Norway, from Iceland, from Europe, and we set up telemed or Zoom call where we get the images ahead of time, and then we talk over the computer and kind of go over things. And then if people are candidates, then basically they set up a time, they fly in and have it done and fly out that same day or the next day, and then we kind of hook them up with physical therapy in whatever the part of the world that they're living in.
Someone else asked, is treatment a one-time event or would there be a need for multiple treatments?
So our plan is one and done. Every once in a while, I have patients who had stem cells done for, were scheduled for total knee replacements and didn't want to do it, and we did stem cells. And I have plenty of people who are out 10, 12 years doing just fine. I also have people that have come back at 10, 12 years and said, it's been great. I still don't want surgery, but they're starting to bother me. Can we repeat it? And yes, it can be repeated. Sometimes, we'll have somebody come back 3, 4, 5 years, they tweaked it, they injured their knee, their shoulder, whatever. And they said, well, should we repeat the stem cells? I said, well, you know what? Let's just try doing a PRP booster, which is basically a blood draw. We isolate the platelets and we inject the platelets in the joint. It's kind of like putting more fertilizer on those seeds. And 90% of the time, patients do just great with just that. And that's a simple 15-minute procedure.
Someone else asked if we have access to Epic. Unfortunately, we don't have access to other offices' imaging. The only office we can access is Reyes Radiology, but we can work with you to get access to your records. And if anyone else has any questions, they're welcome to roll through, but we've answered everything that's come through so far. Let's see. Someone else said, does spine PRP need to be redone?
It sometimes does need to be redone, but it varies tremendously. Depends on the condition and the patient and the response.
Someone else said, I have radiation-induced muscle damage to my shoulder after breast cancer. Can this help the muscles?
It all depends. That would be something I would need to see an MRI and see where the damage is and to what extent we're talking about.
Someone else asked if a knee is a large joint.
I'm sorry, somebody else asked what?
If a knee would be considered a large joint in terms of cost.
So ankles, knees, hips, elbows, and shoulders are large joints.
Someone else asked if multiple joints can be treated at the same time, which yes, they can.
Absolutely, yeah.
Yeah, definitely something we do often, and it's usually more cost effective that way. And that's all I've got so far. Any other questions? Oh, got more. Let's see. Someone said, I want to keep up with my exercise regimen. How long will they be out of the program?
So usually, depending upon the joint we're talking about, if it's a shoulder, you're right back within a week. You can be on a bike, you can be on a treadmill, you can be, running. If it's a knee or a hip, usually by the second week, we're starting back on a stationary bike and then onto an elliptical. But certainly after a week, you can be in a pool. So we try to work with, keeping your fitness level up all at the same time, protecting that joint and letting those stem cells do what they need to do.
Someone asked how soon consultation appointments are available. Dr. Wagner, you know all about that.
Yeah, we can usually get people in within a week or two, right, Chels?
Yep, yeah, we can get people in usually within about a week or so, just depending on availability. But we do try to work with patients in terms of you guys get first choice typically. And then someone asked about pricing again for knees.
Knee is 7,700 and change, I think, somewhere right around there.
Yeah, for one, it's about 7,700. If you do both at the same time, it's around 11,100. And we have a price sheet that we'll provide to you. If you guys want it, we can always send it to you. Anything else from the audience? Oh, cost for thumbs.
What is the cost for thumb, Chels?
If we're just doing CMCs, it's like 5,500, 5,225, I believe. We do both thumbs at the same time. Yes, we can send you price sheets. We do take HSA. That's another question. Typically with HSA, it's a card that we can run. And you would just need to work with your provider, whoever that is, the HSA provider, in terms of just making sure that money is available at the time, because I think they run like debit cards. But again, we can go over all that later. Someone asked if this procedure is available in Houston or Austin.
I don't know anybody in Houston or Austin. It may be. I couldn't attest to their level of experience, expertise, or how many they've done. But I don't know anybody down there in particular to refer you to.
I've got no questions as of right now.
Okay. Well, we'll send everybody out a PDF of our brochure. Everybody who's come tonight, so that'll give you even more information. And any questions that anybody has, feel free. You can always shoot us an email. You can call the office, and we're happy to answer any questions you have. And I'd like to thank everybody who signed on tonight for doing that on such a beautiful evening. I'm ready to get out and kind of go for a run as soon as I get home. So thank you again. And like I said, if you have any questions, just contact us.
Yeah, please give us a call.
Thank you all. And thank you, Chelsea.
You're welcome. Bye, guys.